We're discussing chronic illness and how a holistic approach may help you identify the root cause of your ailment and get on with living life instead of just treating those symptoms. I'm joined now by Dr. Elena Villanueva with Modern Holistic Medicine. She helps patients get to that root cause of the sickness. Thank you so much for joining us, Doctor.
Thanks for having me here today.
Absolutely. So I was reading this earlier, and this was a pretty staggering number to me. An estimated 133 million Americans have at least one chronic illness, nearly 1 in 3. What are some of the most common ailments that we're talking about here?
You know, that's a great question. A lot of the common ailments that we see are things that a lot of people are not really thinking of. It's more of the simple stuff. We need to manage stress. Stress can manifest itself as all different kinds of chronic diseases, even mental health and neurodegenerative disease, unprocessed trauma and emotions, and our foods, believe it or not. There are a lot of contamination there's a lot of contamination in the environment these days, and we're getting a lot of contamination in our foods. And so it's really important to look at those top 3 things. What are you putting into your body? And then what are you putting into your body in terms of your emotions and your thoughts? And so if we can just address these simple yet super powerful things, we actually have seen a lot of case studies and research showing that we can actually reverse almost every chronic disease that is out there if we address those things as a starter.
Yeah, and you covered my next question, the causes behind some of those chronic illnesses. So I want to ask you, what kind of a difference have you seen a holistic approach make, especially for people that maybe would tend to use prescriptions and take other approaches to that?
Yeah, well, you know, the traditional medical model is really solely focused on addressing the symptoms, and that's what pharmaceuticals do. They address symptoms. There is no pharmaceutical that actually cures really any disease. And that's where here in Austin, you know, we're just really lucky because we're ahead of the curve. And even the people that are moving here into this city over the last decade are really much more aware of looking for root causes and then using data like lab work to actually track and make sure that you're able to address it. And that's what holistic and functional medicine does. It's actually looking for what caused the issue and then putting plans of action together to address it at the root cause.
It does seem like it's something I've been hearing a lot more about. And I wanted to ask you, you know, when people go to their doctors and they're maybe getting their checkup, is this something that comes up typically, or is it more of a different approach, would you say?
I think we're seeing more of the traditional allopathic medical doctors that are taking an interest in holistic and functional care. And we're seeing a lot of them going back for training so that they can retrain themselves around understanding how to find the root cause rather than just prescribing a medication. And you know, there's a time and a place for a medication. There always are. They save lives. But if you're really looking to address the root causes of chronic disease, that's where you're going to get the long-term help. And so, yes, we are seeing more and more doctors, especially here in Austin and certain parts of the country, that are wanting to go back and get training for this type of work.
Doctor, unfortunately, I have to wrap, but I wanted to ask you just very briefly before we go to break, how should someone start looking into holistic medicine if they're interested?
Go online and just start researching. Here in Austin, there are a few of us who have been here for 20 years, and then we have a lot of new ones coming into town too. So just go online and look it up. You can always go check out our website at modernholistichealth.com. We even have a conference coming up, and there's a banner up at the top if anyone wants to come and get some training. It's open to the public and it's open to practitioners as well.
Wonderful. Dr. Elena Villanueva, thank you so much for joining us today.
Awesome. Thank you so much.
Absolutely.